Hello everyone, today we're covering something that could make a big difference in your life or the life of someone you care about, the early signs of HIV in women. Understanding these signs can be the key to catching the virus early and getting the right treatment, so let's get into it. Have you heard of HIV? It's completely fine if you're not super familiar. We're here to learn together and break down exactly what it is, how it affects women specifically, and what signs to watch out for. First, what exactly is HIV? HIV stands for Human Immunodeficiency Virus. Basically, it's a virus that weakens the immune system, the body's defense team that protects you from germs and illnesses. When HIV attacks the immune system, your body has a harder time staying healthy and fighting off infections. But here's the good news. If you recognize the signs early and start treatment, you can manage it and live a healthy life. So let's talk about 8 early signs of HIV in women that you need to know about. 1. Fever. Ever felt like your body's burning up when you're not even sick? That's what an early HIV fever might feel like. You could be in a cool room but feel like you're overheating. Your forehead might feel hot and you could break out in sweats. Some women might develop a low-grade fever, just slightly higher than normal, or something more intense that lasts for several days. Why does this happen? Well, when the immune system detects a virus, it raises your temperature to fight it off. It's your body's natural way of sounding the alarm. 2. Unexplained fatigue. We all have those tired days, but this is a different level of exhaustion. It's like being completely drained, even after a full night's sleep. With early HIV, you might feel constantly fatigued. Simple tasks like walking up the stairs, doing errands, or even just getting out of bed can feel like climbing a mountain. This happens because your body is working overtime to fight the virus, leaving you with little energy for anything else. 3. Swollen lymph nodes. Lymph nodes are little warriors in your body. They help filter out germs and protect you from getting sick. You can find them in areas like your neck, under your arms, and near your groin. When your body's battling something like HIV, these nodes can swell up. You might notice tender lumps under your skin that feel sore to the touch. Think of them like your body's security team. When there's an infection to fight off, they get busy and might swell because they're putting in extra work. 4. Persistent sore throat. We've all had sore throats from colds or allergies, but if you notice one that sticks around for longer than usual, it could be a sign of something more. In the early stages of HIV, a sore throat might persist because your immune system is weakened. Without a strong defense, your body has a harder time fighting off other germs, making you more susceptible to infections like those causing throat pain. 5. Skin rash. Skin rashes can show up for all sorts of reasons, maybe from trying a new soap, getting an allergic reaction, or even from bug bites. But if you notice a rash that seems to come out of nowhere and sticks around longer than normal, it might be an early sign of HIV. These rashes can look different from person to person. Red spots, bumps, or blotches on areas like your face, chest, back, or arms. Imagine waking up one morning and noticing an unfamiliar rash that just doesn't seem to go away. If it doesn't improve after a few days and there's no obvious cause, it's important to bring it up with someone, especially a healthcare professional. 6. Muscle and joint pain. Our muscles and joints keep us moving, so it's totally normal to feel a little sore after exercising or being on your feet all day. But if you start feeling achy or stiff without having done anything particularly physical, that's something to pay attention to. Some women with early HIV experience muscle and joint pain that feels similar to flu symptoms. The aches might spread across your body, making everyday activities uncomfortable. This happens because HIV can trigger inflammation in the body, causing soreness and swelling even without an injury. 7. Night sweats. Night sweats are exactly what they sound like, waking up in the middle of the night drenched in sweat even if your room is cool. It's like you're overheating while you sleep. In the early stages of HIV, night sweats can become a regular occurrence. You might find yourself waking up with soaked sheets or pajamas, which can be uncomfortable and disrupt your sleep. This happens because the body is trying to regulate its temperature while it fights off the virus. 8. Mouth ulcers. Mouth ulcers or canker sores are small, painful sores that can pop up inside your mouth. They can show up on your gums, the inside of your cheeks, or your tongue, and they can make eating or drinking feel pretty uncomfortable, especially if you're having spicy or acidic foods. In early HIV, these ulcers can appear more often because your immune system is weakened. Without a strong defense system, it's easier for these types of sores to form, and they might stick around longer than usual. What should you do? If you or someone you know is experiencing these symptoms, don't panic. Remember, these signs don't automatically mean it's HIV. They could be caused by a number of things, from the flu to everyday stress or other infections. The key is paying attention to how you feel and not ignoring what your body is trying to tell you. If you notice multiple symptoms or something feels off for a while, the best thing you can do is talk to a trusted adult or healthcare professional. Whether it's a parent, guardian, or doctor, they'll help you figure out the next steps, including whether you need to get tested, understanding the immune system, and HIV. Before we go, let's quickly talk about how HIV actually affects your body and why it's so important to catch it early. Think of your immune system as your personal superhero team. Its job is to protect you from anything that tries to make you sick, whether it's germs, bacteria, or viruses. A big part of that team is something called CD4 cells, a type of white blood cell that acts like a team captain. They help coordinate the whole defense system to fight off invaders. When HIV enters your body, it attacks these CD4 cells, using them to make copies of itself. As the virus makes more copies, it damages and destroys the CD4 cells, weakening your immune system over time. With fewer CD4 cells, your body becomes more vulnerable to infections and illnesses that it could normally fight off. But here's the bright side. Thanks to advances in medicine, there are treatments that can help. Antiretroviral therapy, or ART, is a type of medicine that stops the virus from multiplying, giving your immune system the chance to recover and stay strong. Early treatment is key because it helps your body stay healthier for longer. Why early detection matters. Catching HIV early can truly change the game. With early treatment, women diagnosed with HIV can live long, fulfilling, and healthy lives. The medicines we have today are incredibly effective at controlling the virus, helping to keep your immune system strong and your body in balance. It's not just about managing symptoms. Early treatment actually lowers the amount of the virus in your body, making it easier to maintain your overall health. Beyond personal health, early detection is also essential for preventing the spread of HIV. Knowing your status means you can take steps to protect both yourself and the people you love. That awareness is key to stopping the virus from spreading further. Understanding HIV transmission, let's clear up some important facts about how HIV is spread. First of all, you cannot get HIV through casual everyday contact. Things like hugging, shaking hands, sharing food, or even playing sports with someone who has HIV are completely safe. This virus is only transmitted through specific body fluids, primarily blood, and also through unprotected intimate contact or sharing needles. Understanding the actual methods of transmission is crucial, not only for protecting ourselves, but also for reducing fear and stigma. When we know the facts, we can push back against outdated myths and treat everyone with the respect and kindness they deserve. Staying safe and healthy. Taking steps to protect yourself from HIV is empowering and something everyone should know about. Here are some ways to stay safe and healthy. Asterisk education. The first step is learning. The more you know about how HIV is transmitted and how to protect yourself, the better equipped you'll be. Asterisk safe practices. When you're older and begin exploring relationships, it's important to make safe choices. This could include using protection and having open, honest conversations with your partner. Asterisk regular checkups. Visiting your doctor regularly helps you keep tabs on your health. Routine checkups can catch any issues early and give you peace of mind. Asterisk. Avoid sharing needles. Never share needles or syringes. This is one of the main ways HIV can spread, so it's a critical practice to remember. Supporting others. If someone in your life is living with HIV, the most powerful thing you can do is be there for them. Offering support, listening when they need to talk, and showing them kindness is everything. Remember, HIV doesn't define who they are. They're still the same person you've always known. By educating yourself and offering empathy, you're not only supporting your friend or loved one, but also helping break down the stigma surrounding the virus. Empathy and understanding can go a long way in helping those around us feel accepted and supported. Final thoughts. Today we've covered a lot, from recognizing early signs of HIV in women to understanding how the virus works and why early detection is so vital. We've also touched on how HIV spreads and ways to stay safe, while highlighting the importance of compassion for others. Quick disclaimer: the information provided in this video by Tip Top Health is for educational purposes only and should not be considered medical advice. Always consult with a healthcare professional for accurate diagnosis and treatment options. That's it for today's video. Don't forget to like this video, share it with others, and subscribe for more informative content. Until next time, stay healthy and take care.